Hi, I'm Dr. Anju Teresa Andrews. I'm a psychologist. Today, we'll be discussing about the different types of anxiety disorders. Anxiety is a normal reaction to stress and it can be beneficial in some situations. However, anxiety disorders differ from the normal feeling of anxiousness or nervousness and it involves excessive fear and anxiety. It can adversely affect the individual's life, all aspects of life, his work, interpersonal relationship, school, etc. The individual might try to avoid situations wherein he believes that his anxiety would be triggered or worsened. Anxiety disorder is an umbrella term that includes many conditions. Let us briefly discuss each of them today. First type of anxiety disorder is generalized anxiety disorder or GAD. It is characterized by excessive and persistent worry that interferes with the individual's daily activities. People with GAD worry about all sorts of things much of the time, like about their work, family members' safety, money, relationships, etc. They always worry that something bad is going to happen, even when there is no real reason to think so. They know it's adversely affecting their life, but they can't stop worrying. For example, an individual with GAD might not want to drive a car because he's worried about getting into an accident. Or he might let go of a promotion because of his worries about not meeting the increased demands that might accompany the promotion. They often seek reassurance from others that things that they fear do not happen. People with generalized anxiety disorder suffer from restlessness, fatigue, headaches, gastric disturbances, muscle fatigue, especially muscle tension in neck and shoulder region. Next type of anxiety disorder is social anxiety disorder or social phobia. Social anxiety disorder is characterized by an excessive emotional discomfort, worry, or fear about social situations. The individual worries that he will be evaluated, scrutinized by others, and he will be embarrassed. There is heightened fear of interaction with others. Individual tries to avoid such social situations, and when they can't be avoided, he endures it with a lot of discomfort and distress. Some of the situations wherein an individual with social anxiety might experience discomfort are meeting someone new, meeting with strangers, for example, attending an interview, or going for a social gathering wherein he'll have to meet a lot of people, or speaking in public, or a performance in front of others, writing, reading, or eating in front of others. Being center of attention is a problem for them. However, normal shyness is not social anxiety. Next type of anxiety disorder is panic disorder. Panic disorder is characterized by recurrent panic attacks. Now, panic attacks are sudden periods of intense fear that comes on quickly and reaches peak within minutes. It can occur most unexpectedly, or it can be brought on by certain triggers such as a feared object or a situation. During a panic attack, the individual experiences increased heart rate, shortness of breath, choking sensation, gastric disturbances, sweating, trembling, feeling faint or dizzy, the fear of dying, the fear of losing their control. Since these symptoms are so intense and so severe that many individuals worry that they are experiencing a heart attack or some other life-threatening illness and may go to hospital emergency room. And since these episodes occur most unexpectedly, the individual is constantly worried about having the next attack and tries to avoid situations which he believes would trigger his attack. Next type of anxiety disorder is agoraphobia. If someone has agoraphobia, he'll be extremely fearful or anxious about certain situations wherein he or she believes that he would experience a panic attack or something awful would happen to them. They worry that they'll be trapped in that situation without any means for escape, and they go over extreme lengths to avoid such situations. Some of the situations that can make a person with agoraphobia anxious are being in enclosed spaces such as shopping malls, cinema halls, or being in open spaces such as park, bridges, playground, or being in a crowd. Next type of anxiety disorder is specific phobia. In specific phobia, the individual is fearful of a specific or a particular thing, object or a situation, and the fear is actually out of proportion to the danger it poses and interferes with the individual's day-to-day activities. He knows that his worry or his fear is irrational and it is not needed, but he is unable to overcome it. Examples of specific phobias are fear of animals, dogs, fear of insects, for example spider, fear of heights, fear of flying in aeroplane, fear of getting an injection. Next type of anxiety disorder is separation anxiety disorder. If an individual has separation anxiety disorder, he would be extremely anxious and fearful of a situation wherein he would have to be separated with those whom he is attached to. This feeling is usually inappropriate to the person's age, and it persists for at least 4 weeks in children or about 6 months in adults. The physical symptoms can develop in childhood, but the symptoms may be carried over to adulthood years too. Next type of anxiety disorder is obsessive compulsive disorder or OCD. OCD is characterized by recurrent unwanted thoughts, images or impulses called obsessions and or repetitive behaviors called compulsions. For example, an individual with the obsession of his hands being dirty resorts to the compulsive action of repeated hand washing. Repetitive behaviors like hand washing, cleaning, counting, checking, reordering are all done with the hope of preventing these obsessive thoughts or making them go away. However, performing these ritualistic behaviors provide temporary relief only, and not performing them markedly increases the anxiety. The next type of anxiety disorder is post-traumatic stress disorder or PTSD. It can develop in an individual who has gone through a traumatic event wherein the life and safety of the individual was threatened, or the life and safety of people around him or her was threatened. This can be a situation such as physical or sexual assault, being in a serious accident, being in war, or being in disasters such as flood, fire, etc. The individual has difficulty in relaxing. He experiences flashbacks, night terrors, and tries to avoid situations that are related to the traumatic event. The goal of this video is to briefly give an overview of the different types of anxiety disorders. We will be discussing about each of them in detail in the coming videos. If you or anyone you know suffer from any of these difficulties, I strongly urge you to seek help from a mental health professional. With the right approach, you can learn to control your anxiety, and thus your anxiety stops controlling you. Thank you.